We have 4,224 cases of coronavirus in Victoria. That's 270 new cases since our last update. We conducted 21,995 tests yesterday, which is a very significant effort given the stay-at-home order and so many people that will be, because of those orders, staying at home. I just want to again thank all of those who've come forward to get tested. It's such a powerful contribution to our fight against this virus. Can I also encourage anybody, even with the mildest of symptoms, to come forward, get tested. That gives us the data, the information, the certainty that we need to deliver this strategy to drive down numbers and to get to the other side of this second wave. That means in total we have done 1,170,352 tests since January 1. We have 1,803 active cases. The breakdown on the 270, and Brett can speak to this in more detail, 28 of those are connected to known and contained outbreaks, and 242 of those are under investigation by our dedicated public health team. That's the story of recent days and weeks. Obviously, with such large numbers, it is a real challenge to get to the bottom of exactly where those people have been, who they've spent time with, who are their close contacts, and then to make sure that appropriate public health responses are delivered at that individual and family level right across those suburbs and indeed right across the state. There'll be a Chief Health Officer release later in the day that will go through all the information as much as we can unpack that throughout the course of the day. But I'm sure you would appreciate there is quite a bit of detective work, quite lots of interviews, lots of work that has to go into trying to determine links between different cases, links between different outbreaks. I want to update you though in terms of, as our task grows, so too does our team, in a couple of parts. Firstly, as I think there's been some reporting of this overnight, Ambulance Victoria, I'm very grateful to our paramedics for the work they do every hour of every shift, but noting that some in that workforce, for a multitude of reasons, can't be out on the road at the moment, but are still very highly skilled. They have that clinical background, they have that experience with dealing with challenging and complex circumstances. There's a team of about 200 that are being stood up to support the work of our public health team. That number will grow over coming days and weeks, and I'm deeply grateful to Ambulance Victoria for the really coordinated way in which they are joining this fight in a public health sense. Of course, more broadly, the work that they do is critically important, more important than perhaps it's ever been. But where there are off-roster paramedics who have all those skills and bring all those wonderful qualities to their work, but can't be out on the road for various reasons, it makes sense for us to call upon them as our task gets bigger and bigger. I spoke yesterday, I think, or perhaps the day before, about a number of important partnerships with the private sector. I can confirm for you we're quite confident that we'll have a number of staff come across to support all manner of different functions in our public health response, from Medibank, from Telstra, from Qantas and Jetstar. Those discussions continue. So this is about making calls, taking calls, all of that follow-up work. As the task grows, the team needs to grow as well. And preemptively, I think where we'll get to is to train up a whole range of staff from our banks, not to use right now, but in the event for either fatigue management or if the task continues to grow, for them to be potentially deployed in some weeks' time. That's just good forward planning. Now, there'll be a joint statement released by the Prime Minister and I later on today, but if I can just give you a sense of other important developments. I had a good long conversation with the Prime Minister last night. We had communicated over the course of the weekend, and I'm very grateful to him for that standing offer. Whatever we need, we get, and that's a really important thing. The notion that if I need something, I can ask on behalf of all Victorians, and the answer from the Prime Minister will be yes. That's a great comfort and something that makes the task not easy, but just a little bit easier to manage. As you know, there are about 335 ADF personnel that are on the ground now, some of which have been on the ground in really important coordination roles and specialist roles for many weeks now. I can confirm that rather than this being subject to requests and offers and a whole lot of paperwork, we're going to have essentially a standing presence So arrangements just get rolled over, and it's kind of an open-ended thing rather than having to fill out heaps of paperwork every couple of days whenever there's even a minor change to the roles, responsibilities and the numbers of ADF personnel that are going to be here. Those open arrangements, or rolling arrangements if you like, were very much a feature of the ADF's response and their support in our bushfires last summer. So so those 335 will continue to do principally what they have been doing, but there may be some changes depending on circumstances. This obviously is very dynamic, but they'll be staying and they'll be there for the foreseeable future. There will be around 1,000 additional ADF personnel that will join us in the days, weeks, probably over the balance of the next 3 or 4 weeks. It'll take some time to get up to that full contingent. To give you a sense of the tasks that they'll be performing, and again there will be a statement later today that goes into more detail, but the Emergency Management Commissioner, the Chief Commissioner of Victoria Police, as well as officials in the public health team in my department, have been working very, very hard over these last 2 or 3 days just to work out exactly where we need to surge, where there needs to be additional capacity, and it'll be things along the lines of State Control Centre planning. ADF are already in there, but there will need to be more people in there. Logistics and intelligence reporting, public health response, principally focused on data management and analysis, information flow, as well as the allocation of tasks, particularly as it relates to onboarding of new staff. So as the team grows, the proper allocation of tasks, and making sure that we're using the best people for the best purposes, making the most of all the skills that we have from that group that I already mentioned, including the private sector, paramedics, the list goes on. There will be direct support from the ADF in relation to our response to outbreaks in public housing towers, so everything from provisioning, getting meals to people, all the other practical things on the ground. That frees up Victoria Police members and allows them to be focused on, if you like, defending that hard border between metropolitan Melbourne, Mitchell Shire and regional Victoria. Support for testing in metro sites, but also rural and regional sites. That's, again, a function that ADF have already been involved in, and we're very grateful to them down at the showgrounds, for instance. We'll see more and more of that, and some test sites that will be essentially taken over by the Australian Defence Force to do that work. That, again, frees up others to be deployed for other tasks. Assisting relevant agencies with community engagement, so door knocking, being out and about, getting information to people, particularly targeted cohorts. One of the most important, it's a bit novel, but one of the most important agreements that we've struck, the Prime Minister and I, is that Ambulance Victoria paramedic response crews, not all of them, but many of them will be now a shared crew. So one member of Ambulance Victoria, so an AMBO, and a member of ADF, that'll be a general duties ADF person who can support the inevitable number of paramedics who will finish up having to quarantine, having to isolate, having to be furloughed because of exposure or the potential exposure. It's also just a great way to best use the resource that we have, freeing up additional ambulance paramedics. That'll be rolled out quite soon and is separate to AV personnel who've come into our public health response. They're two separate things, but obviously the common denominator is Ambulance Victoria personnel and putting them to the best use possible. Compliance checking, supporting Victoria Police with enforcement of the Chief Health Officer's stay-at-home orders and surge capacity as is required at those vehicle checkpoints right across that ring, across regional Victoria and Mitchell Shire. So that is a comprehensive response. It comes from a really strong partnership and it comes from a lot of hard work over the last 3 or 4 days to work out what's needed right now, but to try and be as forward focused as possible, what's going to be needed in a fortnight, in a month, in 3 months even. This is all about trying to stay a step ahead of the needs. That is incredibly challenging when we see the number of cases presenting each day. But a bigger team, and particularly where you've got great confidence that you're purposing or you're tasking the best skills for the best purpose, that's when you can start to see some really significant improvements. Can I, just before I ask Brett to add to my comments on the epidemiology of the day, can I just make a couple of comments in general terms. Can I thank every single Victorian who is doing the right thing? We are all in this together. Whether we like it or not, all of us have got a role to play. All of us have got a really important role to play. Some small, some large. But again, these are the circumstances we confront. This is the reality that we must deal with. And if we don't all play our part by doing the right thing, by calling out others who aren't doing the right thing, by not letting our frustration get the better of us, then as those on the front line, we can have a direct impact on the number of cases, the speed of the spread, the amount of spread that we see right across the Victorian community. All of those things are directly within our control as members of the team, as people that are on the front line. I don't want to see a situation where some Victorians make bad choices and we essentially have to rely upon our nurses and doctors as the last line of defence. We know they're equal to that task, but even so, with their skill, their care, their compassion, if this gets right away from us, then obviously no health system can properly cope. There would always be enormous pressure. We can't leave it to them. We've got to, in many respects, thank them for the work they do by all of us following the rules, every individual, every family, for your own sake, for the sake of your community, for the sake of your state. We all need to be absolutely focused on doing the right thing. Again, I thank everyone who is. That is the vast majority of people. But Victoria Police are out there and they will sadly have no choice but to take action against anyone who is not. I don't have a brief from the Chief Commissioner as to enforcement activity over the last 24 hours. I'm sure that can be provided offline, but we have seen a few examples of people not doing the right thing. This is a wicked enemy. It is so wildly infectious. It moves so fast. It's cunning in some respects, where people can be infectious for quite some time and not know it, not have symptoms, or if they have symptoms, they're so mild. That's why, if you've got symptoms, you've got to come forward and get tested. There's more than 150 test sites right across the state. It's a relatively simple and easy process, and it makes a massive difference, a powerful difference to our understanding about how much virus is out there, where it is, how it's presenting, how it's travelling, and how we can have the most appropriate public health response to it. To everybody making great sacrifices, I'm proud of you, I'm grateful, I'm very thankful. To those who aren't doing the right thing, you just got to improve your behaviour, make better choices for you, for your family, for the entire community. The alternative is really not one that is acceptable to any of us, and you will be fined if you are doing the wrong thing. Beyond that, there is a massive team of people, one that is going to get even bigger, not just to meet needs as they present right now, but to try and be ahead of those needs wherever they might go in coming weeks and months. But those people, as dedicated as they are, as skillful as they are, the fact they're all working 24/7, they're not enough if Victorians don't do the right thing. That's why I'm so proud of those who are, and that's why I've got such a clear message for anybody who isn't. Please moderate your behaviour. Please do the right thing. Otherwise, this strategy simply won't work. And we will see tragedy, but we'll also see lockdowns that have to run longer than they should. We will see a longer second wave than would otherwise be the case. It's the right thing to do. It's also the smart thing to do as well. Can I now ask Brett just to add to my comments, and then we're happy to take any questions that you have.
Thanks, Premier. So 270 new cases today. It's a bigger number than yesterday. I warned that we can't be complacent about numbers on a day-to-day basis. It's not as high as our biggest single day, but we haven't turned the corner yet. I hope to see that this week, but there are no guarantees. Again, we have to rely on everyone doing the right thing in order to drive numbers down. It does mean that we have over 1,800 active cases in Victoria. That's a really significant number of people with coronavirus. And it does mean that in the next fortnight, we're going to see a number of these people who will require hospital. There's often 10 to 20% of all coronavirus infections who require hospitalisation. So that's a couple of hundred individuals at least who will require hospitalisation in the next couple of weeks. GPs have a really critical role in looking after these current individuals with coronavirus. I would just say to them, please be in touch and make an assessment of the clinical needs of those individuals. If people are deteriorating, now is the time to make an early referral or linkage with acute care or our tertiary care system, because they'll want to see these patients early. They'll want to be on top of clinical management early with dexamethasone or remdesivir or whatever therapy that might be available to them. But it's important to see some of these patients early if they're deteriorating, so that they can avoid the worst outcomes, intensive care or death. So I hope that those linkages are made. We do have a number of outbreaks that are current. 147 cases linked to Al Taqwa College. That hasn't really changed in recent days. 14 cases linked to Brunswick Private Hospital. There are now 28 cases linked to Menarok Life Aged Care Facility in Essendon. 13 cases linked to Estia Health Aged Care in Ardea. 11 cases are linked to Lamanna Supermarket in Essendon. And 14 cases linked to Somerville Retail Services. There are also 9 cases linked to Senvic Construction Riverina Apartments in Footscray, and many more, as you'd know, cases in aged care, often a single staff member or a few staff members, but a few significant outbreaks with a number of residents who were notified and who were picked up through that very extensive testing that's done immediately once a staff or resident case has been notified to us. But it's a challenging situation with aged care. Sometimes those residents are looked after in place. If the isolation, single rooms, ensuite bathrooms are available and those patients, residents can be managed on site, that's done. In other facilities, because there's a shared bathroom, because there are difficulties in managing the movement of residents around the facility, they'll be transferred, as has been the case with Menarok Aged Care.